18 to 4, going to break some news because the IV fluid shortage, it's now hit the critical shortage point. I can reveal to you exclusively that doctors, nurses and Perth Children's Hospital clinical staff have been emailed this morning advising that stock levels are now at critical shortage levels. They've been instructed to conserve IV fluid. The guidance document is advising staff to use smaller bag sizes and slower rate infusions. It says you need to limit the administration of fluids to day patients and minimise fasting in surgical patients. So we haven't seen the critical alarm bell called until now. And a local intravenous fluid stewardship working group is being established to work on this urgently during the week. Michael Page is the Australian Medical Association WA President, and he joins me live on 6PR this afternoon. Dr. Page, welcome to the program.
Afternoon, Ollie. Thank you.
A critical shortage is an elevation in the advice. How concerned are you?
Oh, look, this is very concerning, Ollie. It indicates that there's been really across Australia and probably at the federal level a lack of planning for this type of event. You can't understate how important normal saline is. So intravenous salt water basically is in the healthcare setting. It is an absolutely ubiquitous product. It's used every day in every hospital thousands of times. So it's used to maintain patients' blood volume and blood pressure during surgery. It's used to resuscitate patients who are sick with infections or any other critical illness. It's used to administer medications. So medications are put into little bags of normal saline to be able to give them to people. It is a really critical product, and it seems simple as well. It's salt and water. It's certainly nothing. There's nothing fancy or patented about it. Yes, the manufacturing of it is technically demanding. It has to be sterile, manufactured in a sterile way so that it doesn't transmit infection into patients. But it's a really critical product, and it's really concerning that we're running out of it.
If this advice is going to doctors, nurses, and clinical staff at PCH, how worried should we be if you've got a child who's going to be going in as a day patient and you read that the guidance document says to limit the administration of fluids to day patients, to minimise fasting in surgical patients. And while it explicitly doesn't say to cancel any surgeries, it does say that consideration should be given with avoiding excessive fluid restriction in patients undergoing major surgery, as this can be harmful and lead to an increased risk of acute kidney injury and infection. So will all of these surgeries still go ahead, or might some be cancelled, or have they already been cancelled?
Look, I think people can be confident that everything will be done to ensure that surgery, when it's performed, it can be done safely. So the most likely outcome, if we really get to levels of IV normal saline that are extremely low in terms of stocks in the hospitals, is that elective procedures will have to be cancelled. There's no doubt. If our hospitals can't procure normal saline to meet the demand of surgery, then it will really have to be prioritised for non-elective surgery, emergency surgery, cancer surgery that has to be done, within a very short period of a time from diagnosis. So that's what we will see. So I don't think people should be alarmed if they've got a booked procedure or their child's got a booked procedure and they have to take them into the hospital tomorrow. I don't think they should be concerned that an adverse outcome is likely to occur because, the health department is clearly taking this seriously. The hospitals are taking it seriously. Doctors and nurses are taking it seriously, and they'll do everything they can to ensure patients are safe. But at the end of the day, if prioritisation has to occur in terms of some procedures being cancelled or postponed, then that's what will happen.
PCH is where this advice has come from. Are you aware that similar advice is being issued to other hospitals and within WA Health?
Not to my knowledge just yet, Ollie, but it wouldn't surprise me if it closely follows. But having said that, it's a pretty dynamic situation, and there are other suppliers around the world who are now exporting normal saline to Australia, the price has become astronomical compared to what it used to cost. 5 to 10 times the price for a bag of salt water than it was 6 months ago in some instances. But that's what our system will have to do. It will have to pay more, and it will have to get its hands on normal saline from anywhere in the world where we can obtain it.
Michael Bates, thanks for your time.
Anytime. Thanks, Ollie.
Australian Medical Association WA President Dr. Michael Page.